This is a stop motion of thyroid eye disease. Symptoms of thyroid eye disease. Symptoms of thyroid eye disease include bulging eyes, which is called proptosis in medical terms, irritation of the eye pain, overly watery eyes, dry or gritty eyes, blurry vision, double vision, puffy eyelids, and pressure on the eye socket. This is your eye, and that is your eyeball. Behind your eyes are muscle and fat that are made up of cells. On the cell that makes up the muscles and fat behind your eyes, there are receptors. Autoantibodies are malfunctioning antibodies. Antibodies are proteins in the immune system that identify and destroy invaders to your body. So, autoantibodies destroys and targets healthy tissue, which can cause autoimmune diseases. These autoantibodies turn on the receptors, leading to the swelling of muscle and fat behind the eyes. This is what an eye looks like before the receptors are turned on. And this is what an eye looks like after the receptors were turned on. Some demographics are at higher risk of getting thyroid eye disease, including females, people who smoke, and older people, typically 40 and up. Graves' disease versus thyroid eye disease. Graves' disease is an autoimmune condition that has an overactive thyroid gland, also known as hyperthyroidism. Thyroid eye disease is an autoimmune inflammatory condition. It affects tissue and muscles behind the eyes. Around 90% of thyroid eye disease occurs in people with Graves' disease. Although often seen together, they are not the same. Diagnosis of thyroid eye disease. First, doctors will review medical history and labs. Then, they'll check for symptoms, look at the motion of your eyes, and do vision tests. After that, they may order imaging and blood tests. Imaging tests include CT scans and MRI scans. They test the risk of compression of the optic nerve and other tissues around the eyes. The blood tests measure TSI, or thyroid stimulating immunoglobulin, which is the antibody controlling the production and release of excess thyroid hormones. Treatment often includes lifestyle changes like quitting smoking, using eye drops, and wearing an eye patch or sunglasses. Treatment options also include medication and surgery.